So
Okay.
what drew you to dermatology specifically as a specialty?
Um, my father drew me to dermatology as a specialty. Being the child of immigrants, you have a choice. You can eat or you can study. And so my father and mother encouraged me to do it. I didn't really want to do it, but I was very curious and interested in lots of different fields, and he thought dermatology would give me a good balance. What kept me in dermatology was just I didn't realize the depth of the impact of the skin on people's overall quality of health. It allows me to, I find the service of medicine to be very fulfilling. And there's lots of diseases that don't have good treatment options. There's a lot that do.
Mhm.
And then the connection to communities, like dermatologists stay in communities for generations, and our family is from Port Huron. That's where the clinic started. And Hamzavi Dermatology started about 42 years ago. And even in my youth, I could see the impact of that practice on its community. And people have trusted the company for so many years, and we trust the communities we serve. And then building this deep sense of community, connecting it back to science and society and medicine, that was really fulfilling. So what kept me there was that.
Well, that does make sense because especially with the community aspect of it, I mean, especially once you're in the community, people will trust more because you live here with us and you are one of our neighbors. That's perfect. But so for viewers who may not be familiar with your practice, what does a typical day in dermatology actually look like?
Sure. So as we recognize the community, I just wanted to recognize Dr. Salayman, who was the oral surgeon, unfortunately passed away a few years ago. And we knew his family. He was actually a young student putting his way through school, and my father helped him buy some books many, many years ago. And a super talented young man, and unfortunately, passed away, but was a really good oral surgeon. His family reached out to us about the office space. So that office space is very much a continuation of his wife Manal and Dr. Suleiman, and just his efforts in kind of building a local community presence for oral surgery. And we decided to convert that to dermatology. So what does a typical day look like? So it involves a wide range of activities. It could involve somebody worried about a spot in their skin that's potentially a skin cancer. It could be a benign growth that people are worried about a skin cancer, but they just need a little bit of reassurance. It could be a wrestler walking in who is wrestling in his first middle school meet, but he's got a rash, and they have to make sure it's not a fungal infection. It could be a teenager with acne. It could be a individual with an autoimmune disease where they get massive wounds in their underarms and their groin. It has tremendous pain and odor, but they don't want to talk about it, and it's very painful, and they need some discreet care and want to be able to cover that. It could involve somebody who's aging, who wants a little bit of Botox for some forehead issues. It could involve somebody who has has had many sleepless nights because their baby has severe eczema. The skin is ripped open. Their face is bright red all the time, and everybody's asking the parents, like, "Don't you want to take care of your kid?" Or just that look that we get sometimes. And then the mom and dad haven't slept in weeks. Well, we try to help calm the itching down, help heal the skin, but also help take care of the family unit. Those are some of the general things that we do in dermatology. About 90% of what we do is medical. People sometimes think we only do cosmetics or we only do skin cancer. Skin cancer is about maybe 20-25% and can be very serious. But we also take care of things that make life difficult and don't always end life, but they just don't make life comfortable. So it's a wide range of these behaviors, and you'll often see people again and again and again. You'll see generations. Grandma may come in for skin cancer, then she sends her son in, the son's daughter comes in for acne, the son comes in for a skin check or a fungal infection. And then you start learning about the families, and you share your family with them, and you talk about what your aspirations are. And then you end up talking to people about very sensitive topics, and they advise you, you advise them, and then hopefully you have a connection that I think most people, or a lot of people, yearn for.
I, I do, yeah, because especially that connection to the doctor over time. I actually went to the same pediatrician that my mom went to, so
Mhm.
I totally understand that because it makes you more comfortable knowing like, oh, you helped my mom, you helped my aunt, or whoever it happens to be. And with obviously the medical side of things, people, like you said, usually think, cosmetic or skin cancer. What kinds of skin concerns do you mostly see here in Southeast Michigan outside of that?
So right now we see
Mhm.
a lot of eczema because it's
Yeah.
cold and we're by our fireplaces or have turned up the heat. There's not enough humidity in the air. And so itchy winter skin flares up. Those are things that we'll see this time of year. We will see a lot of fungal infections because the wrestlers are in full gear and wrestling away. We see a lot of acne for people who have concerns about that. And then we do see a lot of skin cancer. We see a lot of prevention of skin cancer for spots in high-risk locations and high-risk individuals. We also see actual skin cancers and help manage those. And in the Dexter office, we have people who can help you take care of the prevention or treatment of those skin cancers. We also have people who actually can treat the skin cancers with a specialized technique called Mohs surgery. And usually you have to drive into the University of Michigan or Canton office for our offices or St. Trinity, which are great facilities. But right there in Dexter, you have somebody who's got a deep expertise in Dr. Ramesh who can do that for you. So we have the full gamut for that. The other things that we will often take care of are discoloration. People, when they have white spots or dark spots, especially the middle of the face, it's very disfiguring. So we help figure that out. So if you have a condition like vitiligo, like what Michael Jackson had, we can take care of that. If you have
Oh,
sunspots that are disfiguring, we can help you take care of that. Those are some of the general things that we see. And then oftentimes we'll see rashes that are linked back to internal issues. So we'll see somebody with a rash and it might be a lupus. So we want to make sure the kidney function is okay. Or we'll see somebody with a rash in the knuckles and we want to make sure they don't have rheumatoid arthritis. So there's a lot of things you just walk in that people just start questioning,
mhm.
and then it ends up being something that's linked to their internal health as well. And then lastly, we see a lot of mental health. A lot of people, when they have a lot of anxiety or stress, they will rip up their skin or create certain change in their skin that if you only take care of the skin, we won't address the core issue. So we'll often work with mental health professionals or do some of it ourselves to try to get them back to a place of well-being.
So the skin conditions can often be seen more as like a gateway almost to other things that might be going on.
Yep. Yep.
Excellent. So, I mean, I know you mentioned the cold weather as well, and obviously with cold weather, we do get the drier skin, like you mentioned, itchier. How does that exactly affect conditions like eczema or psoriasis? And what are some simple ways people can combat those conditions?
Sure. So eczema, which is usually itchy before it turns into a rash, gets pretty bad when the humidity drops. So you really want to try to take short showers. You want to use a moisturizer that you're comfortable with. Thicker the better, but if you don't like thicker ones, you can have an ingredient called a ceramide, ceramide, which adds a level of moisturization without adding the thick petroleum type substances like a petrolatum, Vaseline type derivative. You want to also use liquid cleansers if you can that have a moisturizer built in. So when you use a bar soap, the pH can be a little bit too high for the skin. So sometimes using a liquid cleanser can be helpful. If the windows turn misty, then it's usually too long and too hot. But in the wintertime, you just want to stay in that shower and just get that nice heat. Well, if you tend to have itchy skin, you got to be careful. And then when you go to bed, if you can kind of just put a moisturizer on after putting a little bit of water on your skin and then sleep with longer sleeves and longer legs, then that will serve as a barrier to retain that moisture. So you'll wake up with skin that's not quite as dry. If you're using a fireplace or if you're turning up the heat quite a bit, then consider adding a humidifier to your room or just making sure that your central humidity is set at the setting that's appropriate for this time of year, which is usually a little bit higher than the humidity you have in the spring or the fall. Those are some simple things that you can do. And then sometimes if you have an itchy area, just 1% hydrocortisone ointment over the counter will often fix it. Same thing applies to psoriasis. Psoriasis itches in about 1/3 of people, but 2/3 of people it's disfiguring, but it's not itchy. And that's usually in the elbows, but using a moisturizer, a thicker one, can often help that. That's not quite as sensitive, but the thing is that when you lack UV exposure and basic sunlight, your psoriasis will often get worse. And so doing the same things I just mentioned earlier for eczema can apply for psoriasis, but you probably need a medicated ointment if it gets really, active.
So when should someone stop trying to do the self-treatment options and seek their primary care or even a specialist like yourself?
So if it affects you, the quality of life, so there's a couple of domains of quality of life. So one is, are you sleeping okay? So if you're itching all the time and you've tried those things, you probably go see somebody. Secondly, if you're breaking through the skin and you're bleeding quite a bit, you should probably see somebody because that broken skin can get infected. And then the third time is when it starts affecting your activity. So if you're covering up skin, you're not going to certain events, then it's time to look at the social and mental impact of those conditions and see somebody, because skin and mental health are tied together. And if you keep suppressing that, then at some point it starts to bubble over to other areas. So if you start changing behavior because of your skin, then it's time to see somebody.
Excellent. So if you could give viewers one simple thing that they could start doing right now to help protect their skin and better take care of it, what would that advice be?
So it depends on what your needs are. But if you tend to burn quite a bit, then using sun protection, a simple sunscreen in the summertime, especially, and or spring in Michigan, because spring's gonna hit quickly in Michigan. It's gonna get hot suddenly, and then people will burn in April and May. So
Yep.
using a sunscreen, before it gets too warm outside, it's important. But just sun protection. That doesn't mean you should avoid the sun. It just means that you should manage your sunburns. And then the other component would be that take shorter showers and use a simple moisturizer in the wintertime, and that will usually take care of most itchy skin.
Oh, excellent. So then, one thing I like to do whenever I'm speaking to anybody, I like to take the last couple minutes to allow the person I'm interviewing to say something that maybe they have on their mind or they would like the general public to know about, for this instance, about dermatology, about skincare. Is there something that you feel that is often overlooked or overemphasized that you could elaborate on here for us today?
I'm going to talk about something very broadly, and then
Mhm.
I'll get into a detail. So I think a lot of physicians want to be healers, and we didn't go into this to make people's lives difficult. And I think a lot of us are bothered by the distrust that some people have in the medical establishment. I want people to know that we are servants to our communities and we're not perfect. But we have trained for years. And if there's concerns that you have, we're happy to listen to them. And if there's feedback on how we're doing, please let us know what we can do better. But medicine is society and science together, but we serve our communities. And that gives us a lot of our happiness. Like, some people think that people go into medicine and we get paid well, we're compensated well, but really why we go is because our lives are full of purpose and meaning. And you really, in the back end, don't really get paid enough to do what you do if you only look at dollars. But if you look at the connection to people, knowing your life means something, that is so fulfilling. So just that trust. I know society's going through this shift right now, but I want people to know that even though the healthcare system can be very stressful sometimes, we're not in there for that. So please talk to us about it whenever you're seeing us. As far as the actual visits, your skin goes through developmental phases. Eczema, cradle cap, itchy skin is common in infancy. Then you go through a phase of acne, which is normal and common. And then you're going to go through a period where the skin's relatively stable. And then in your 40s, you'll start developing, 30s and 40s, you'll start developing new spots. Most things that happen are normal. And people get concerned about red spots called angiomas or brown spots called seborrheic keratosis. There's usually nothing to worry about. So if you can just go to the American Academy of Dermatology or go to your own trusted website and just look at your normal transitions of your skin over time, it can reassure you. And if you need us, we're here. But you should also know what's normal for my age. And what's normal is that your skin will never be what it will look like when you're 29. It's going to shift all over the place, and that's okay.
That's just normal, natural part of aging as we, experience life. Yeah.
Yeah.
And I appreciate the emphasis on making sure we're trusting doctors because I had a condition when I was younger, prolactinoma. So I've spent time with doctors, and so there's a training, a specialty, and there is a need for such a position and person in our society. So I appreciate everything that you guys do.
And we appreciate our patients because without you, there's no purpose and meaning. So we got to keep that connection and try and remind myself and the other people in our group, but also physicians in general, like we had to be accountable to you. And I hope that we did the job of taking care of you. And I'm glad to see that you're doing your job so well today.
Yes, I can say that there's a lot of things that were improved from the treatment and care that I got from my specialist. So yes, I really do think we need to trust that the doctors do want to help us. They're not in this for the money. They are in this to help and serve the community, like you said. So yes.
But the system needs reform, and we need to kind of work together to fix it. And it's our system, and
Yeah.
so we're looking forward to working with you on it.
Absolutely. Well, thank you for sitting down with me today. And I'm sorry about the time
That's okay, Brian.
for us, but I do want to thank you for sitting down with me today. And I'm going to make sure we get this information out for everybody to see within the next few days.
Okay, thank you so much.
Thank you. Have a good day.
Bye-bye.